10 medications that can destroy your liver. Did you know that all the medications and supplements you take have to pass through your liver, and that liver damage resulting from medication use, called drug-induced hepatitis, can occur immediately or up to 90 days after ingestion of these substances? In the USA, more than 2,000 cases of acute liver failure occur annually, and half of them are caused by medications or supplements. Several medications can harm the liver. However, 10 of them are particularly harmful. Therefore, it is crucial to know which they are and to avoid their excessive use. In this video, I will present these 10 medications that most harm the liver and explain the early signs of liver damage caused by medications. Because of this detoxification function, certain substances can be extremely harmful to your liver. What are the early signs and symptoms of liver damage caused by medications or supplements? You may have stomach pain, fever, diarrhea, nausea and vomiting, dark urine, white-colored stool, a colic stool, yellow skin, which can also affect the white part of your eyes, the sclera, turning them yellow, severe fatigue or drowsiness, itching, and skin irritation. How long does it take for the medication to damage the liver? This varies from person to person depending on individual sensitivity to medications. Factors that influence include the dosage taken, your age, if you are already using substances that can harm the liver, or if you already have a liver problem such as chronic hepatitis, fibrosis, cirrhosis, or a history of excessive alcohol consumption. Usually, symptoms of liver damage caused by medications appear between 5 days to 3 months after the start of treatment. Although I am focusing on medications, it is important to remember that alcohol also causes serious liver damage, being responsible for about 10% of liver transplants. Illegal drugs such as cocaine also negatively affect the liver. A warning: if you take one of these medications that I am going to talk about here and it was prescribed by your doctor, do not stop by no means. Many medications are essential for controlling certain health conditions. If they have been prescribed by a doctor who is following your case, you can continue using them safely. What are the top 10 medications that destroy your liver? The last one is the main one, so stay until the end. 10th medication that can damage the liver: Diclofenac. All anti-inflammatories such as ibuprofen and naproxen have the potential to cause liver damage, although it is a rare event. However, Diclofenac stands out as the anti-inflammatory with the highest risk of causing liver injuries. These damages can manifest weeks or months after the start of use. Therefore, it is important to be aware that not only the kidneys can be affected by Diclofenac, but also the liver. 9th medication, Amoxicillin plus Clavulanate. The combination of Amoxicillin with Clavulanate is a widely used antibiotic and highly effective in treating a variety of infections, including sinusitis, tonsillitis, pneumonia, and urinary tract infections. However, despite its effectiveness, there is a significant concern related to this medication. It has been associated with hundreds of cases of acute liver injury. Acute liver injury is a serious condition that involves sudden damage to the liver and can have serious consequences if not promptly identified and treated. Therefore, when prescribing or using amoxicillin with clavulanate, it is important to be aware of this risk. Healthcare professionals should monitor patients for signs of liver injury, especially if they are using the medication for extended periods or in high doses. Patients should be advised to seek medical care immediately if they experience symptoms such as jaundice, yellowing of the skin or eyes, dark urine, extreme fatigue, nausea, vomiting, or abdominal pain, which can be indicative of liver problems. 8th medication, Amiodarone. Amiodarone, also known as Cortisone, is a medication often used by cardiologists to treat cardiac arrhythmias. It is one of the most effective options, significantly improving arrhythmia and even clearing 24-hour Holter records. However, it is important to be aware that Amiodarone is one of the medications with the highest index of side effects. It can affect the thyroid, lungs, skin, and yes, also the liver. Because of this wide range of side effects, its use has been more restricted currently compared to the past, being applied in specific cases where the benefits outweigh the risks. Generally, Amiodarone does not cause acute liver injury. It takes a few weeks to months for the harmful effects on the liver to manifest. 7th medication that can cause liver injury, Allopurinol. For individuals with elevated uric acid levels or suffering from gout, diet modification alone is not always sufficient to control the condition. In these situations, allopurinol is often prescribed. This medication is effective in reducing uric acid levels in the body and preventing gout attacks. However, it is important to be aware that allopurinol can have adverse effects on the liver. Liver injuries associated with the use of allopurinol can occur quickly, sometimes within days or weeks after starting treatment. For this reason, patients who start treatment with allopurinol should be carefully monitored for any signs of liver damage. Regular medical follow-up is crucial to promptly identify any problems and adjust the treatment as necessary. In addition, patients should immediately inform their doctor about any unusual symptoms that may arise during the use of allopurinol. It is important to emphasize that despite these risks, allopurinol remains a valuable therapeutic option for many patients with gout or high levels of uric acid. Sixth medication that can affect your liver: anticonvulsants. The medications phenytoin, commercially known as Dilantin, and valproic acid, Depacan, are among those that can cause liver damage. Phenytoin can start injuring the liver right after the start of its intake. The effects of valproic acid can manifest between 1 and 6 weeks after the beginning of treatment, which is why it is important to monitor liver enzymes regularly. Besides these, carbamazepine and lamotrigine can also cause liver injuries, although this occurs much more rarely. Fifth medication, methotrexate. Methotrexate is a medication widely used in the treatment of various conditions, such as rheumatoid arthritis, psoriatic arthritis, and some types of cancer. However, a crucial aspect in the use of methotrexate is the need for continuous monitoring of liver enzymes, since liver injury is a common side effect associated with this medication. Liver injury caused by methotrexate can range from mild to severe, and in some cases, can lead to significant liver damage if not detected, protected, and managed properly. For this reason, doctors usually perform regular tests of liver enzymes in patients who are taking methotrexate. These tests help to identify early any sign of liver damage, allowing adjustments in the medication or in the treatment approach to avoid major complications. Furthermore, following medical guidelines regarding dosage and frequency of use of methotrexate is essential to minimize the risk of side effects, including hepatic ones. In some cases, depending on the patient's health status in response to treatment, the doctor may consider therapeutic alternatives to reduce the risk of liver injury. Fourth medication that can damage the liver: antifungals. Antifungals, particularly fluconazole and itraconazole, which are highly effective in treating candidiasis and nail mycoses, are related to hepatotoxicity in susceptible patients. Therefore, if you are using these medications to treat mycosis, it is important to be aware of the signs of hepatic toxicity mentioned earlier. Third medication that can affect your liver: Methyldopa. Methyldopa is a medication often used in controlling high blood pressure. This medication is notable for its safety, being even the most prescribed for pregnant women with hypertension. However, despite its overall safety, methyldopa has been associated with potential liver damage. Therefore, its use is not recommended for individuals who already have liver diseases such as fibrosis or cirrhosis. It is important to be aware that adverse effects on the liver can manifest up to 12 weeks after starting treatment with methyldopa. Therefore, patients using this medication should be monitored regularly to detect any sign of liver impairment. This care is essential to prevent worsening and ensure that the treatment for hypertension does not cause additional damage to the health of the liver. Patients with a history of liver diseases should discuss safer alternatives with their doctors. Second medication, antipsychotics. Risperidone and quetiapine, marketed under the name Seroquel, are antipsychotic medications that, in addition to being used in the treatment of psychoses, are also employed in cases of refractory depression, that is, those depressions that do not respond to conventional treatment. Both medications have the potential to cause liver damage, mainly through a process known as drug-induced cholestasis. Drug-induced cholestasis occurs when there is an interruption or decrease in the flow of bile from the liver. Bile is essential for the digestion of fats and helps in the elimination of certain waste from the body. When medications like risperidone and quetiapine interfere with this process, bile can accumulate in the liver, potentially causing hepatic damage. Patients being treated with these medications should be carefully monitored for signs of liver problems. First medication, paracetamol. You probably guessed correctly. Paracetamol is the main medication associated with drug-induced liver failure. Normally, liver injury is not caused by the usual dose, but rather by excessive doses. Due to its popularity, some people end up abusing the medication. Instead of taking the recommended amount for a headache, for example, they may take 3 at once and repeat this overdose. It is important to emphasize that the recommended doses of paracetamol are safe. Doctors prescribe paracetamol to babies to treat fever or pain without problems. However, exceeding the recommended dose is dangerous. Of the cases of liver failure attributed to medications, more than a third are due to paracetamol. An overdose of paracetamol can lead to acute liver failure, which has a high mortality rate and often requires a liver transplant. If the organ cannot regenerate itself, unlike the kidneys where hemodialysis can temporarily reverse renal failure, in some cases, the liver, once compromised, often requires a transplant. Furthermore, alcohol consumption, genetic factors, and the intake of other medications on the list can increase the risk of liver injury. The damage to the liver caused by paracetamol usually begins between 1 and 3 days after the ingestion of the medication, with symptoms appearing 2 to 4 days later. There is an antidote for paracetamol overdose, acetylcysteine or fluimucil, which is an expectorant and also used for some cases of OCD and trichotillomania. This antidote is effective in protecting the liver in cases of paracetamol overdose. But if you exceeded the recommended dose, it is better to seek an emergency room and explain the situation to the doctor instead of risking the need for a liver transplant. It is essential to know that just because a medication is not on the list, it does not mean that it cannot damage the liver. The list of medications with hepatotoxic potential is extensive and includes antiretrovirals, vitamins such as niacin, other antibiotics, as well as supplements and even teas, which were the subject of another video. The liver is a vital organ, and its malfunction can impact the body as a whole. To prevent drug-induced hepatitis and, in more severe cases, fulminant hepatitis, it is essential to use all medications with extreme caution. Fulminant hepatitis affects a significant portion of people with acute drug-induced hepatitis who develop jaundice, yellow skin, and among these cases, only 20% survive without a liver transplant. Did you like the video? If yes, I highly recommend this video about olive oil mixed with honey for you. You'll be amazed by the power of these two combined.